Thank you, Christian. And thanks for holding out and sticking with us Sunday morning, talking about exercise and science and patience and performance and recovery. And we will do so too with this topic, which deals with the plasticity and neuromuscular function in response to exercise. And of course, those persons first finding out that exercise, and in particularly resistance exercise, can be used to improve neuromuscular function, those guys were basically first to start with the athletes. And eventually it turns out that some, in fact, if not all of the knowledge and experience that these athletes and their coaches have, so in other words, you have, that knowledge can be quite nicely transferred to non-athletes and elderly and frail injured patients too, to speed up recovery and accelerate rehabilitation. And I will show you some examples on that as we go along. And for you guys working with the conditioning of athletes, it must be, I think you have to realize that the knowledge that you have is transferable to many, many other types of places in society when it comes to stimulation of human beings and improving nervous system function, tendon function, muscle function, eventually improving functional capacity. Talking about the neuromuscular system, we may put up a cartoon like this, which is of course very simple and also perhaps too simple. We have the brain, we have the spinal cord with the spinal motor neurons, and these motor neurons are innervating muscle fibers. So once we want to activate the fibers, we send a message from the cortical motor cortex, and that will activate spinal motor neurons that will send out action potentials, nerve impulses, at a given frequency, so at a given firing rate down to the muscle fibers that are being innervated. There are also lots of information coming up afferent, so going from the periphery into the nervous system, and much of that information will either activate or excite spinal motor neurons, but most of it may inhibit motor neurons. So modulating all of this by means of exercise, to me, is interesting, and I hope we can talk about that for the next 50 minutes or so. And I want to show you examples on how training can lead to adaptive changes in neuromuscular function in athletes, but also in patients, and how this affects functional capacity, mostly in the terms of improving explosive strength, rate of force development, or maximum strength, or improving power. For old people, it means improving postural balance and ability to sit and to rise and sit from a chair and walk up and down stairs, but equally important, I'd say. So athletes have for many, many years been doing types of exercise, plyometric exercise, and in particular resistance exercise, to induce improvements in this entire system here. Maybe they haven't been aware of it, but still, this is what have been going on, and especially in track and field, there's enormous experience on how to refine this system, how to improve the system to the max. And we know this when we see the sprinters, and it's obvious for many of these athletes from track and field, they've been spending quite a lot of time in the weight room. And it's not just to become muscular. In fact, this athlete is not in particular very muscular, but she's extremely strong. The same goes for this guy here. Why this workout? Why this improvement in neuromuscular function? Well, it does lead to an enhanced sports performance, and it may also reduce injury risk. Exactly the same thing goes on for an old person. Or I know, of course, they are not going to compete in the Olympics, but in fact, you have to realize if you're very old, walking up 2 stories of stairs might be like competing in the 100-meter games of the Olympics. At least for some old people who are very close to the limit of sustaining an independent lifestyle. So improving neuromuscular function in these old persons will also improve performance in their activities, athletic activities I almost said, but that will be activities of daily living, so horizontal walking, chair rising, and so on, stair walking. So we have the same goals, and as I will show you, we can use the same means, tools to get there. Why do I have a focus on resistance training? And here you see an athlete, same thing goes here. Here you see an old, healthy individual. Here you see a COPD patient. Here you see a hip replacement surgery patient training after getting a new hip, the injured or the affected limb. So why all this focus on resistance training? Well, the reason is that you can't find any other exercise modality that will have similar positive effects on improving mechanical muscle function. You can't achieve this with endurance training. You can't achieve this with stretching. You can't achieve it with sensory motor training. You need to go to some kind of exercise where the demand of lifting a heavy load is inherent and built in, and then there will be improvements in mechanical muscle function. By which I mean, we will increase force and also power in response to this type of heavy resistance or resistance training. We will increase, maybe this is the most important parameter, increasing explosive strength or the rate of force development or the rapid force capacity. So the ability to build up very high force in fractions of a second. Important for a sprinting athlete when she starts. Very important for an old person to avoid a fall or reverse a fall. We talked yesterday about maximum eccentric strength. Power can be elevated, increased also, and will be increased in response to heavy resistance strength training. In fact, although weights are heavy and movements for that reason appears to be slow when you look at it, in fact, maximum unloaded movement speed is improved following a regime of heavy resistance strength training, especially if you allow people to recover a little bit afterwards. Now, looking at the neuromuscular system, we need to have a focus on the basic units of the neural system, and that would be the motor unit. Just, you know this cartoon, you know this scheme of one spinal motor neuron, and you have them here of different sizes. Here's one spinal motor neuron with a very thick motor axon that runs out, and it divides and activates a number of muscle fibers, not just one, but for the quadriceps maybe several hundreds of fibers. As you know, when we have the spinal motor neurons that innervates the muscles around the eye, they run out and they may innervate one or just two muscle fibers, maybe three, and that allows a lot of fine motor control. The same for the fingers. Whereas for the hip extensors, hamstrings, knee extensors, propulsive muscles, one single motor neuron will be innervating many, many hundreds. Less ability for fine motor control, but high ability for high force due to the high number of fibers innervated. Once one of these motor neurons send out a nerve impulse to the fibers, and maybe you have more motor neurons that does that thing during a voluntary contraction, you will have a high number of nerve impulses traveling along the muscle fibers as we have muscle activity going on. And those motor unit action potentials, those tiny, tiny currents, they will sum up by the surface of the muscle, and we can record all these nerve impulses as this so-called EMG signal, electromyography signal. So this is the more or less chaotic sum of thousands of action potentials, so nerve impulses that spreads out over the muscle fibers once being sent out from the spinal cord. So basically, the more motor neurons we will be activating and the higher frequency of firing they will have, the more of this signal will show up in the EMG recording. So the higher the amplitude and the higher the frequency of the signal. So I will show some examples on how we are using this analysis to estimate the neural drive from the spinal cord to muscle fibers during muscle contraction. So this is one way of measuring. Another thing is measuring the Hoffman reflex, which we also talked about yesterday. So spinal evoked reflexes, telling us something about spinal motor neuron excitability. I'll get back to this today. Also, and then yet another possibility is to have a magnet and make a magnet pulse down into the brain, which will activate cortical motor neurons in the cortex and eventually send down an impulse that activate muscles that are specific for that area where you stimulate. So you can actually find the area where you have the biceps femoris or the biceps brachii located. You give a magnetic pulse and the arm will go like that. Or vice versa, if you find the area for the tricep, the arm will extend and so on. But what is interesting is that we can measure the EMG signal down there, and the amplitude of that motor evoked potential will tell us something about the excitability of the corticospinal pathway. So there are different techniques that I want to introduce to you that we use to quantify how much can be changed in the nervous system in response to resistance exercise. I will have a focus on the rate of force, explosive strength. As I mentioned, this is by far the most important parameter we have to improve in athletes, and by the way, also in old people and patients. And I want to show you some of the changes that goes on in the spinal cord in response to heavy resistance strength training. Not only during eccentric contractions, which we talked about yesterday, but overall taken. But this parameter here is a good point to start looking at the rate of force development and looking at the neural component that is determining this ability here. So basically how we are measuring the rate of force development, very simply, very often during a static contraction of the quadriceps, so we will be blocking the arm of the isokinetic dynamometer, locking the knee at around 70-degree of flexion, where it's strongest. And then we will say to this person, 1, 2, 3, push, 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 push. And once he starts pushing, we'll be sure that we will tell him beforehand that he needs to make the muscle force go up as high as he can. Well, it's actually not muscle force, it's force put down here on the force transducer, right? And we tell him, try to make that force increase as steeply as possible, as fast as possible. Secondly, you should also think about reaching a maximum force eventually throughout this 2 or 3 seconds contraction. So we will also be recording this here. And you see here, for this is kind of a slow person. He's 0.8 seconds to go to maximum force. And in most events, in most movements in real life, you will never have that much time to generate force. In fact, when you are running on a field, you have 100 milliseconds to produce force. You will never be able to go up to a level where you have maximum force generation. If you take off for a high jump or spike for a volleyball, slightly longer time, 200 milliseconds. And you have to think about all these movements, which you probably can recognize from your own sports or your own athletes, moving fast, that in how many conditions, and how many of these movements do you have time to reach maximum force? Almost never, because it does take 0.3 or 0.5 seconds to go to maximum force. In that time, your foot will have left the ground, your hand will have done like this, you have thrown the ball, or you have pushed your opponent away, way beyond that time, or before that time point happens here. So in many situations, the rate of force development is much more attractive, have a high rate of force and a steep rise up here, more attractive than having a high maximum force. Okay, some of you know that you're doing a lot of training to improve maximum force capacity of athletes, and actually that turns out to be a quite nice way of improving rate of force, because when you improve maximum force, the rate of force development also goes up. But we can make it, maybe we can stimulate this even more better than just improving maximum strength. So we talk about this as we get along. So to try to locate the determinants of the rate of force development here, the slope of this curve, now it's not newtons or force anymore. Now we take the distance from the force transducer up to the center of rotation of the knee joint, if it had been allowed to move. So I know this is a static contraction, but we can, so this rotational axis of the dynamometer is aligned relative to the knee joint axis. So if we take the distance, the lever arm distance, and multiply with the force, we get the knee extensor torque. And this is more comparable between athletes of different gender and size and so on. So this is actually the knee extensor torque generated by the quadriceps muscle. And what you see here is the EMG activity, nerve impulse activity in the lateral vasti. You see, it's over here, you see the electrode. You cannot see it on this particular side. We have the medial vasti, we have the rectus femoris up here, and you see the EMG signals coming out here. We can analyze the EMG and we can analyze the rate of force to see how this connects, how well this relates. And Jonathan Follen and Tillin from University of Loughborough in the UK, done that in guys, athletes like this, comparing these athletes to non-athletes. And these were track and field athletes, sprinters and jumpers. So what you normally would call power athletes. But in fact, what turns out, I know they may be powerful, but more interesting, they have very high explosive strength. So their rate of force development were measured and compared, and also the ability to send out nerve impulses by measuring the EMG signal amplitude was also quantified in this group of athletes compared to untrained controls. And what Jonathan Follen was able to see with his co-workers was that in absolute terms, now this is only the force, so it's not calculated into Newton meters or torque, is you have the controls that come to a lower force for a given period of time relative to onset of contraction, and you see the power athletes are reaching a higher force at 50, also at 100, also 150 milliseconds. It's quite visible to you. And if you take that force and divide it by the time it took to go there, you will have a measure of the rate of force development. So basically, comparing these forces between subjects is like comparing the rate of force development between these subjects, right? You get that? Okay, anyways, so you see that getting to a higher force up here means that they have a higher rate of force development, these power athletes. Even when normalizing for the fact that power athletes are also stronger, so if they took these force values and divided by the maximum force value, then you get a percentage. And this is what you see down here, percent of maximum voluntary force. Even in that case, power athletes in normalized terms were more explosive, at least in the very initial time interval, compared to untrained controls. So it's not simply a matter of being very strong. There's something extra also going on in there when you're a power athlete. Eventually, I will show how we can turn athletes into power athletes like these by means of resistance training. But what you notice here is that in absolute terms, there's a higher rate of force in absolute terms in the entire contraction phase, and in relative terms, we had it at the very initial phase here. And the reason is, I'm sorry about this very busy slides, is that measuring the EMG activity in the very first 50 milliseconds and in the next 100 and in 150, comparing the EMG signal between the power athletes and the non-athletes, so the dark gray and the light gray, you see a different, much more EMG activity in the very initial phase in the power athlete compared to controls. Not in the second and not in the third phase, but in exactly that phase where we see this superior relative rate of force development going on. We have much more EMG, and that goes for the VL2. There's a difference here, not in the later phase and not in the even later phase, and the same for the medial vastine. So it seems that among many things, power athletes do have an ability to have extreme high neuromuscular activation in the very initial phase of muscle contraction. They have other benefits too that contribute to a higher rate of force. Often they tend to have more type 2 fibers proportion. That will also increase the rate of force. Also, they tend to have larger muscle. That will also tend to increase the absolute rate of force, and so on and so on. But now we have a focus on neuromuscular component. So let's look at the general effect of resistance training. I mean, can we turn every single person into a power athlete like this? And the short answer is actually yes. You can do that. And most of you are doing that when you are exercising your athletes. Of course, I know getting to precisely that particular level where you have a national team track and field power athlete, probably you can't take everyone and put them to that level. Probably they are born with some extraordinary capabilities beforehand. But you can get a long way. And this is how far you can get with 3.5 months of heavy resistance strength training. I'll show you the program in a second. But this is the force, or rather the torque time curve for the quadriceps before, average for all the young people, and then after the period of strength training. What you probably can see that within the first 30 or 50 milliseconds, these young guys go to a higher force. And also in 100 milliseconds, and also within 200 milliseconds. So we kind of have an early phase rate of force development, which is very important for getting out of the start block and accelerating in 1 or 2 or 3 steps. And then we have the late phase rate of force, which is more important once you are a little bit up in speed, are approaching even faster speeds. So we have early and late phase rate of force adaptations going on. And calculating the slope of this curve for each single subject, that will be measuring the rate of force. We get these values. Significant gains at the very initial phase of around 20%, and somewhat comparable gains, I guess, at the later phases too. But overall, we get these marked gains both at very initial phase and the somewhat slower phase of rising force. When I talk about heavy resistance strength training, this is what I mean. These are the loads being lifted, and this is the number of training sessions. So 3.5 months, we end up by almost 40 sessions in these young men. And you see the number of sets here, 4 sets by 10 repetition maximum and perform to failure, so 10 reps. And if they could take 11, they will put on more kilos. You have the exercises here, squat, leg press, knee extension. So 3 exercises and quite a large number of sets. So this is kind of the high volume period of the program. You have many pretty heavy loads and many sets. But you see that what goes on towards the end is that loads are getting heavier and heavier, 4 and 6 repetition maximum. So intensity going up, but the number of reps is going down. And the number of reps goes more down in percent than the intensity goes up in kilo. So total volume goes down. So it's a form of tapering at the same time which intensity goes up. Perfect for peaking in terms of performance when we would do the post-training measurements out here. So it's a very crude undulation model going on here. We are measuring the EMG also to see how this would explain or match the increases in rate of force which we saw in response to this program here. I have to mention one thing, by the way. None of these subjects, none of these young men ever got any instruction about performing this exercise in an explosive manner. So they simply lifted their loads. And if you don't have that instruction, you don't need it. But if you don't have it, for sure you need to have the very heavy loads, because what happens lifting the very heavy loads, basically, which you know, you need to try to accelerate, because if you don't accelerate, it will stop. It's that heavy, so it will simply stop halfway. So from the central point, from the point of the central nervous system, you will have to accelerate all the way. Although looking at it, it looks slow and non-accelerate because it's so heavy. But inside and in your spinal motor neurons, the contraction mode is accelerate, 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 accelerate. And this is more pronounced the heavier it gets. And probably this is why the very heavy lifts are very good for neuromuscular improvements. Now we can take these EMG signals and do a filtering, and then they look somewhat like this. They are more consistent and more easy to reproduce by this filtering procedure. And we can calculate the area, so the average amplitude of the EMG in the initial and later time phase intervals. And what we see is something like this. If we look at the lateral vasti, before training we have an EMG activity of this size. After the 3 months of heavy resistance training, it's about 100% increase in the very initial time phase of contraction. Also at 0 to 50 milliseconds we see more than 100% increase for the lateral vasti. In the somewhat later interval we also see a significant increase, this time around 80% increase. So a huge increase in neuromuscular activity in the prime knee extensor muscle that we have in there. For the medial vasti, you see would be comparing this one to this one, no difference. Or comparing this one to that one, no difference here. But over here at 100 milliseconds, comparing this one to the middle one here, there's a difference. And the reason why we have more variability and can't see a change in the medial vasti is because it's doing a tracking on the patella. It keeps patella on the medial side and you know, prevent it from going on the lateral side due to the high forces of the lateral vasti. So it does serve more than one function, more than just a crude knee extensor function. I believe that's why we have this kind of variability in that particular muscle. Rectus femoris, it does increase here from 0 to 50, it goes from here to here, and also in the 100 milliseconds, it goes from here to here, also significant. So increased neuromuscular activity. I got the idea when I saw these signals, well, maybe maybe it's possible to calculate sort of a rate of force development for the EMG signal. So basically trying to calculate the slope of the EMG curve to see whether this is increased also in relation to the increase in rate of force development. And it turns out very much to be the case. So basically calculating the slope of each EMG curve for each muscle in each person. And you can see for the VL it goes from here to there in the first 30 milliseconds. It goes from here to there, huge increase in the first 50 milliseconds, and also increase 75 milliseconds. And basically, doing this analysis, we can see improvements for every single muscle group. So it's more sensitive analysis of the change in neuromuscular activation during explosive type contraction after strength training. So I think this is a very important finding, that we can see that heavy resistance strength training, despite the fact that it's not performed as explosive training, newer studies have shown that if you do that, actually, if you do those training exercises explosively, you will get even greater improvements in rate of force. I'm just saying we may not need to start there. We can just start with the heavy lifts, and that will give you quite much of the effect. Well, anyways, the result will be an increase in the amount of neuromuscular activity sent to the muscle fibers, and that will result in an increased rate of force development. And quite a few studies have shown this. I think Dieter Schmidtbleiger and Martin Bürle from Germany actually were the first in the world to introduce this phenomenon of rate of force development and the connection to neuromuscular activity. So they're quite classical studies here. Not a lot of people know these studies, but they are very interesting. Some of this has been shown in old people, Barry. Some of this has been shown in old people who go into hip replacement surgery. Exactly the same results, only on a smaller scale. Increased rate of force due to more neuromuscular activity. So it's quite robust finding. And of course, increasing rate of force is quite important. It does have very important functional consequences, because what you need to improve acceleration is to improve rate of force development against the ground. That's the only thing that will cause your body to accelerate to a higher speed following training. So thinking about soccer players, team handball players, volleyball, basket, everyone who needs to go from a standstill or a low speed to a very high speed as fast as possible during the game, they will need improved rate of force. They will benefit from improved rate of force. And that means in short time, in short fractions of a second, they will be able to reach higher speeds, so they will move faster. And when they move faster, they will reach higher force because of the higher rate of force, and therefore higher power. In old people, having a high rate of force, that means that once you are about to fall, what will save you or won't save you is whether you have a high rate of force or not have a high rate of force development, to shift the weight on your feet and avoid, stumbling over the edge of your foot. So old people also have very high demand for rate of force development in many, many conditions during their everyday life. If we dig down a little deeper into why neuromuscular activity is so important for increasing the rate of force development, it turns out to be the properties of spinal motor neurons, is in particular the firing frequency. So how many nerve impulses a single spinal motor neuron can send out per second is decisive for the rate of force. So if you can improve the rate of force development by resistance training, does that mean that you're improving the maximum firing frequency of motor neurons in the spinal cord? And the answer is yes. This is exactly what you're doing. And thinking about it, this is exactly why you take the athlete or the patient and send her or him to the gym. That is to improve the maximum firing frequency of spinal motor neurons. Then the side effect may be that muscles are growing too, and tendons, by the way, also. And that's very often a nice side effect. This study shows the importance of firing frequency on the rate of force development. And it's Arnold de Haan from Netherlands some years ago did this in a rat model, stimulating the gastrocnemius muscle electrically. So dissecting the nerve in the intact rat and measuring the force in the muscle. It's sleeping, of course, so won't feel much. And then they stimulated the motor nerve, innervating the muscle by 80 hertz, getting to this force here, 120 hertz getting to this force here, and then 200 hertz getting to this maximum force. maximum in the sense that stimulation by 400 hertz didn't, yield any higher force. So 200 hertz, 200 nerve impulses per second would be the titanic innervation frequency of that muscle, enough to give you maximum force. What more do you need? Well, what happens with an even higher stimulation rate, 400 hertz, it doesn't really change max force production, but the steepness of the slope, it's much higher. So it rises up much faster, a higher rate of force. So sometimes we call this having a supra-maximal firing frequency will give you an increase in rate of force. And that means that we need to have changes going on in the nervous system that goes beyond generating maximum titanic force. We need to target this zone, and we need to have much higher firing frequencies that we normally would need just to lift maximally. Okay, now what happens with the firing frequency following resistance training is that it's markedly increased. And this is one classical study, not in the biceps, actually it's in the TA muscle, so the dorsiflexors. And imagine or not, they were able to do resistance training on that ankle dorsiflexors for 3 months. It wasn't super heavy loads, in fact, it was 40 to 50% of one arm, but it was maximum acceleration. And if you take the actual force with such a low load, if you have to multiply acceleration to get the actual load going in there. And if you do that, it turns out that peak loads were actually quite close to 80 or 70, 80, 90%. It's the same when you do the Olympic lifts. Once you are accelerating your loads, it's much more than 70 kilo or whatever it says on the bars. It can be twice or 2.5 times that force or that weight if you are accelerating at maximum speed. It's the same thing here with this training. So actually, although it's called low force ballistic training, it's actually high force ballistic training, turns out. But here you have the firing frequency of the motor neurons innervating this TA muscle, and they put in EMG electrodes inside the muscle tissue, and they can look at the shape of the motor unit action potentials in there, so they can identify a single motor unit potential and see now it's firing, and now it's firing once again. So we have the same spinal motor neuron having 2 nerve impulses separated by 2.4 milliseconds. Here's is another motor unit, and here's yet another motor unit. So they have very distinct shapes. In this way, it's very elaborate, and I think only 1 or 2 labs in the world can do this analysis, especially during maximum muscle actions. But they are very, very good in this lab by Jacques Ducheteau in Brussels. And what they were able to do was to measure the time between firing from single spinal motor neurons. And if you take that time and divide it, you take 1 and divide by that time, then you get frequency. And these are the numbers here, firing frequency. Before training, the first time motor neurons are firing is very high, and then it drops down. The next firing may come over here, I don't know, and then the third firing interspike intervals. But after training, you see almost doubling in the frequency of firing of these motor neurons. So this is apparently what people are learning by doing resistance training as such. Increasing maximum firing frequency of motor neurons, and it's quite extreme how much is increased. But looking at the difference here, you also see that, well, it doesn't really change going from 200 to 400, but it does increase rate of force quite much. So maybe we need to have a huge change over here to have this change in a slope, steepness over here. And we're quite sure that this does explain why they have this increase in rate of force development. You may be able to see it better over here, that before training the slope of this curve is kind of slow. This is during a dorsiflexor action with a certain kilos. And this is the same kilos being lifted after, and you can see that it's much steeper when they record the force into the weight stack. So the steepness here is plotted up here, and it's plotted as a percent of how heavy the loads are, and you get this curve relationship before and this relationship afterwards. And when this is shifted up, it means that we have a higher rate of force development for a given level of force. It's kind of a complicated way of showing the improvement in rate of force, but that's the way you have to do if you have free movement and non-isokinetic measurements going on in them. So improving rate of force development by means of increasing firing frequency is extremely important. And this was young people, young men and women, and similar results, not using ballistic training, but using traditional heavy resistance training have been done in young people and old people, and even very old people. We can demonstrate that there are increases, maybe not this impressive, but comparable gains in maximum firing frequency, especially on the quadriceps muscles in these experiments that have been done subsequently. So it's a robust finding, and it does happen in young and old people quite uniformly. So in the final part of my talk, I want to address this plasticity and spinal motor neuron properties in there. So what is it that makes us learn to have a higher firing frequency? One thing that happens is that these motor neurons become more excitable. That's the term. All it means is that they become more sensitive to a given synaptic input. You may say they become easier to activate, but it's more complicated than that. It means that for a given synaptic input, then they will send out more nerve impulses per second. In other words, have a higher firing frequency, right? So looking at measurements on how to quantify excitability or sensitivity of spinal motor neurons after training, it's really interesting. And that would be these Hoffman reflex, which we talked about yesterday. And just to reiterate, it is sort of a stretch reflex, where, the stretch reflex, you punch your hammer here, you pull the patella down, which will pull the quadriceps tendon, which will pull out the quadriceps muscle, which will stretch the muscle tendons, and as a reflex, the spindles here will send into the spinal cord through this 1A afferent a nerve impulse that synapse onto all the motor neurons that innervate the muscle. And this will take, so the conduction speed here is around 70 meters per second. These are the thickest nerve axons in the body, so they're very fast, the fastest we have, these 1A afferents. So this will take, say, about 12 milliseconds or so. It may take another milliseconds to cross the synapse, and then the reflex impulse will run out and activate all the muscle fibers a little slower, because these motor axons are thinner, and the nerve impulse will run at around 50 meters per second, so somewhat slower. So that might take another 15 milliseconds. So all in all, maybe 30 milliseconds. And doing that, we would see some kind of reflex being measured out here if we put on EMG electrodes. The problem here now, if we want to use this stretch reflex to address the excitability of the motor neurons, then we have to punch this tendon with the exact same force before and after training. And then we will see if they make a more forceful kick, or an increased reflex after training. That will kind of tell us that it was easier to activate these motor neurons, right? The problem, of course, is we can't really standardize how hard we are hitting this tendon. And by the way, like Preston told you, the tendon will be thicker and stiffer as a result of training. So we don't know for sure how the stimulus will be on the muscle spindle. Instead, we are stimulating the peripheral nerve with an electrical shock. And that is an Hoffman reflex. And we can standardize this very, very accurately, so we can have the same stimulus strength before and after training. So we are sure that we are sending in the same amount of synaptic input to the spinal motor neurons before and after training. And then we look at how much EMG signal and how much nerve impulses they are sending out in response to that synaptic input. That will be the amplitude of this EMG signal, the H reflex down there. So getting an increased response following training. So if this would be increased, if we measure this during maximum contraction, and we can do that, if this is increased following training, it means that excitability of these spinal motor neurons has increased. It's easier to activate the spinal motor neurons. They are reacting more sensitivity to a given synaptic input and sending out more nerve impulses for a given synaptic input, okay? More efficient transmission, in other words. And we do that, we can do that. It took some time to design those studies, but they're doing some isometric force ramps on the muscles, and once they get very close to maximum force, they get the stimulus on the nerve, and then we can measure this H reflex during maximum contraction. We can also do this at rest, but it turns out that nothing happens. no change in resting H reflex. We need to do the recording during actually maximum contractions, and then we see huge changes, improvements here. We have another variant that we can do during maximum voluntary contraction, which is it's also an H reflex, but it's called a V wave. And in that case, we are putting a very, very strong stimulus, a very high current to the motor nerve or to the peripheral nerve. For the H reflex, it's a somewhat smaller and current pulse that we give, but if we give a maximum pulse in here, we get the so-called V wave. We also take into account the number of nerve impulses that runs from the motor cortex down and into the pool of spinal motor neurons. The more nerve impulses we have here, the higher this V wave will be. Basically, I won't really go through it because that would take another 7 minutes. So I hope you believe me. This is how we do it, and this is a measurement that we have. So the V wave kind of incorporate cortical factors, and the H reflex alone talks about spinal factors. I have to be a little more complex than that. The V wave, in fact, also includes spinal factors. It includes everything in this entire chain, but the H reflex only records spinal properties, okay? So keep that in mind as we get to the results in a second. This is how we do it. So they go into a maximum plantar flexion. We have a metal plate which gets pressed down upon the thigh here. So, you know, the knee won't move like that. And we can record the force getting to 95% of max. They get a stimulus shock inside the fossa here, and where we have the tibial nerve which innervate the plantar flexor muscles. And the exercise they did where you saw the loadings, and we also did these calf raises. Why do you think we're using the flexed calf raise and not the standing? Yeah? It's to get to the soleus. Yeah, and it is. It's because we get, you know, the most beautiful H reflex signals we can have will be in the soleus. We're also doing the recordings in the gastric muscles, and for that reason, in fact, we also did have some standing straight knee heel raises. But for the soleus, this was to target that particular muscle. And here you see before training and after training, 10 recordings. So they have 10 sessions, separated by 1 minute of break, and it takes about 3 seconds to go to max, and then they get the stimulus. And then we have these 3 attempts at maximum force, and we get the one with the biggest V wave before training, and then of all the trials we had after training, then we get the one with the biggest V wave after training. And you may be able to see a huge change in this particular subject, right? And this kind of analysis, we're doing this for every single person, and quantifying the change in H reflex. What you saw before was a V wave, but the change in the H reflex, we see a 20% increase, 20% increase in the amplitude of the H reflex. This was only addressing the change in spinal motor neuron excitability, so only spinal factors. But the V wave increased almost 60%, and that one comprised both cortical and spinal efficiency. So it turns out that if we combine the measurement of including both spinal and cortical factors, we get a 60% increase, but spinal factors alone only 20%. In other words, there got to be some 40% contribution from the cortical factors. This is a very crude comparison, and it's not really true, but basically, roughly, you can see that this indicates we have both cortical adaptations or gains in central descending drive, and also, besides from that, pure improvements happening at level of the spinal cord down here. So motor neurons becoming more excitable. So seeing this increase in V wave and also H reflex response during maximum contraction tells us that we have gains both at the brain and at the spinal level. So the V wave tells us that we have an increased descending motor drive, the fact that the V wave is increased more than the spinal cord, and the fact that we do have an increase, or V wave is increased more than the H reflex, and the fact that we also have a separate increase in the H reflex tells us that we have changes in motor neuron excitability or changes in synaptic inhibition down at the level of the spinal cord. So this is a result of non-explosive strength training, that we have these huge changes both in the brain and in the spinal cord. And a number of studies have shown this now in a number of people. And it just came out in old people too, by the way, for the first time, for a few weeks ago. And before we end, I just want to show you some results. This was young people, potentially athletes, which you just saw. How about heavy resistance strength training in neurological patients? Can we see the same changes? And basically, yes, we can. And I want to show, this is quite a remarkable study from coming out of, I want to show you here from Trondheim in Norway. And they were looking at MS patients. As you know, we have the MS disease. We have this degeneration in the myelinization of these peripheral axons for the motor neurons that innervate the fibers, so meaning that it becomes harder and harder for the subject to activate muscle fibers. And eventually, muscle fibers will atrophy and they will die. And eventually, there will be very, very little active skeletal muscle mass, and mobility will be quite severely reduced. So it does mean that MS patients, they are not able to fully activate their muscles, very poor. Their maximum firing frequency is very, very low. So it also affects spinal cord properties, and maximum strength of those patients are very, very low, up to 70% reduced compared to HMATs, healthy controls. So you can imagine how this negatively will affect function. So in this particular study, they had access to these MS patients for 3 weeks. So the patients were invited, in Trondheim, they were invited to this course facility, and they were invited to stay there for 3 weeks to learn ergonomic interventions, how to arrange your kitchen in a different way if you can't move around very much, and if you don't have strength in your limbs, which tools can you use to open a can, and ergonomic counseling, basically. But half of those subjects were also allocated to maximum strength training, so heavy loads in percentage of their maximum capacity. And they trained every single day, weekday, and maybe not optimal, but that's the way they train, to have enough sessions in only 3 weeks of time. And what happened is that the maximum strength increased very much for the plantar flexors in that group doing the resistance training, and doing the V-wave measurement during the maximum plantar flexions, you see a huge increase in those MS patients doing the resistance training, and not those guys being controls, not training, nothing happening at all. So in other words, we can have huge changes at level of the brain and actually the spinal cord, and all the way out to the muscle fibers during maximum contraction in response to strength training, even in severely affected neurological patients. And just to compare our young people before training, so untrained young men, they had a V wave of around 30% of the maximum M wave, which is a normalization that we do to compare between people. And you can see prior to doing any type of training, they were severely affected. These patients, they were around half the size of the V wave, but they got more than halfway, they got 2/3 of the way back to a young normal person, just within 3 weeks of intensive resistance training intervention. So having data like this is really interesting in neurological patients, but fortunately these are the only ones for the current being. But just tells us that the training experience you have with the heavy weight lifting can be transferred quite nicely to even frail patients and have fantastic results. So just spending half a minute on summary. This is a lot of information, but this is basically all the benefits that can be documented in response to resistance training, effects in the nervous system. We can have more EMG activity, so increased neuromuscular activity during maximum voluntary contractions. The rate of EMG rise, which corresponds to the rate of force development is also increased. Yesterday we talked about eccentric contractions and inhibition. You remember the untrained individuals, lots of inhibition in the nervous system doing resistance training. Inhibition is removed, and we have much more EMG and less inhibition, meaning that eccentric strength goes up. A very profound neurological adaptation. And as you just saw with the V wave and H reflex, excitability of spinal motor neurons is increased, and supraspinal drive also is increased from the cortical regions. Maximum firing frequency of motor neurons also increased, very important for increasing rate of force. And we have more synchronized EMG activity. What it really means, I'm not sure anyone really knows for sure, but it does come out as an effect of resistance training. And then some peculiar thing is happening also. Your spinal motor neurons is learning to have ultra high firing frequencies. So a firing frequencies of 200 hertz and beyond that is extremely unusual in human beings, but it's called discharge duplet. So if you have one spinal motor neuron that sends out a nerve impulse, and less than 5 milliseconds later, during the contraction, sends out another, then we call this a discharge duplet or a firing duplet. And in untrained people, when you do maximum contraction, about 3%, 3 to 5% of the spinal motor neurons have that behavior. But following resistance training by the Kutsum study, it turned out that 35% of all the motor neurons after training had learned to have that behavior. And having that ultra high firing frequency is very important for having a very steep rate of force development, can be shown. So duplet firing also quite unique feature that you are actually learning your athletes when you do heavy resistance strength training. And having all these changes happening in the nervous system at level of the brain, at level of the spinal cord, have important functional consequences. The increase in rate of force is probably the most important thing, but all the other parts, for athletes improving eccentric strength, also extremely important, I think. So it's just to sum up that these gains, ultimately the gains in functional performance are important. This is why we do the training. Part of the reason is the plasticity in the nervous system here. And it's important for athletes, but also for older and individuals and frail patients. And basically we're using the same paradigm, the heavy resistance strength training, with various types of progression, slow or fast, or depending on the starting level of your patient or athlete. But the idea, basic idea, the tool is basically identical for all these subjects. So thanks a lot for your attention, and I would not bother you anymore with any more lectures for a while, but we have time for a few discussion.
So any questions for this great talk of Per? Yes, yeah.
Thank you again for another excellent presentation. I am sitting in my chair, trembling with excitement at the phenomenal results that laboratory scientists, clinicians can achieve. But yet there is such a great gap between what we get in the lab and the end product that we can offer to our fellow humans as patients, and funding by government, and every single European funding organization is saying we're running at a loss. As a hip surgeon, some of my hip replacement implants cost £15,000 a time. But yet we would rather do that than do excellent work like what you're offering, which with 20% increase one way, 40% increase the other way, with the V wave and the H reflex. Why can't we get more people to believe what we are saying is what I'm saying? That's my question.
It's a crucial question. And it's so important. I can see that things are slowly changing in terms of, in the clinic, in terms of rehabilitation. But I guess it all comes down to convincing the politicians that the patients, they of course should have the best surgery and the best implants and so on, but you will get so much more out of it in terms of years. It will hold on, and the effectiveness over time, if you combine that with proper, what do you call it, training, which is, evidence-based training, basically. So in other words, that means more money to the rehabilitation units, to the physiotherapists and the exercise physiologists, who, by the way, needs to collaborate much more strongly than before. And rather than, with a hip replacement patient having maybe money for 1 or 1.5 months of rehabilitation, there should be money for at least 3 or 4 months. And in that rehabilitation, there should be designed, developed, individually designed heavy resistance strength training to rebuild muscle mass, to take advantage of that new implant in there, because it doesn't come by itself. muscle mass doesn't come back, neuromuscular function doesn't come back. So we need somehow to make that clear to politicians and decision makers that we need to much more money and knowledge into rehabilitation clinics. How to do it, I'm not sure, but we need to do it. Maybe merging private fitness with physiotherapy rehabilitation clinics. That happens in Scandinavia. So you see more and more physiotherapy clinics who are also fitness clubs. And once a patient gets fully recovered, he or she stays in that fitness just to keep up and get even stronger, even better in terms of function. So I think we can have more merging on of these expertises. Maybe we have more better long-term results.
Actually, I want to reply to him. I have really to say that I'm kind of sad. I'm kind of sad when I see what's going on here, because this is such a great thing, I think, that we have so many great presentations and so many good wisdom spread, but there are so less people here. And this is a huge problem in reply to your question. Because the wisdom, the science, is not spreading enough. And then there's coming the people who are more interested in selling. And this is a real problem. Because you have to take this wisdom to the fitness studios. You have to take this wisdom to the medicines. Yeah? And when you go out and look, for example, in some kind of medicine book, and what they are recommending there, what training they are recommending there, they are not recommending this. They are recommending, like, stay with your 25 to 30 repetitions all the time. Going less might be hurting people or what else. So I would be very, very happy, and especially in Germany, this is a huge problem, a huge problem. I would be very happy if there would be more congresses like this in Germany, if more people would come here and listen to this, and if the word would more spread in a really science-based way, and not like in a way I want to make money. And then it would come to the people's mind and to the medicines, okay, we have to change something. And to the people on the street, okay, we have not to get operated, we can go to do something ourselves, and listen maybe to a medicine who says, okay, we don't go to operation directly, we put up a nice training regime to you. But this is a problem here. This is really a problem. This is sad.
Truly agree. So this is an invitation. So if any of you have contact to the annual meeting in the German Society of Physiotherapy or Sports Medicine, then contact Sven, and he can contact all of us who works with these aspects, and we would be happy to go in for a session, half a day or whatever, with workshops and discussing the science and how to create networks that connects the professionals, so you can support each other. And we could do sessions like that as an incorporated part of the annual meetings in your societies. So I think one way could be to use Sven, because you have an impressive network. I totally agree. And then try to go out and get more people realize these things, start discussing. Because my experience also is that the more of the younger physiotherapists do have that knowledge. I mean, you're not afraid of using these techniques and seeing the science, just make you even more confident that this you can do, and you can improve, rehabilitation on your patient. So the more and more of the young physiotherapists we get, in our site and, educate, the more we can make changes happening, I think. So.
Thank you.
Sorry, I'm just being greedy again, but since no one is going to ask another question. Another passion of mine from being an ex-international sprinter is in the belief that the maximum force production is phenomenal, as you've said, but also reflex reaction speed time. I would just like to hear your own opinion in terms of our elderly patients and how that correlates, those two determinants correlate to the risk of fall. I heard you say the maximum force production,
on the maximum rate of force.
Maximum rate of force production was the greater thing, but I would like to know what you think about the speed of reaction in terms of reducing the risk of falls. Thank you.
And that's another lesson that can be learned from track and field. It's like a treasure chamber of knowledge that you have in track and field, especially the track sports. And what we know about old people is that their reaction time capabilities are very poor compared to young people. And it's partly because the conduction speed of the motor axon may not be 50 milliseconds, but maybe half of that. So it takes a long time for the nerve impulses to get out. There is also a cognitive delay in processing and realizing, oh, something is happening now. I probably should react now. And if you think about the track and field athletes, they are highly sharp on all these factors, decision making and central actions going on, and then all the peripheral interaction too are so optimized in track and field. So it will always be poorer in old people. What happens with the reaction time following resistance training in old people, I never seen data on that. No one ever tried to measure that. But I would imagine it would be an important factor. And if we could document that response time to be improved, to be faster, that would explain, the decreased risk of falls following a period of resistance training in old people. But that's also an important component. And I don't think it ever have been measured, actually, in any study. But it would be important.
I had a question in regards to the implementation and especially with the athletes. I think we actually discussed it in another symposium, IRC symposium we had, that we had Christian Thorborg discussing the whole issue of that so much science on hamstring injuries shows that if you want to do the patient better, you have to increase the eccentric strength and so on in order to treat it, but also to prevent future injuries. And but what he sort of came up with was that the frustration that we have this knowledge to come to the patient or the athlete was the big issue. And I think it is by the end of the day, or it is the bottom line, the problem. Have you any comments to that? How we could come around it, Per?
So the frustration about what? I'm a little confused.
Yeah, maybe the fact that we have this knowledge, but many of our athletes, there's data to show that maybe they don't take it in, and
I think it's not on fault of the athletes. I mean, they are just poorly advised by their trainers, and especially being a physical trainer to an athlete, you are sometimes overruled by the technical trainer or the trainer for the team. And although you would like to do the eccentric hamstring exercise at least once a week on all the players, sometimes you're simply not allowed to do it. That's one of the reasons. And I guess some physical trainers are also maybe, at least in soccer, they are a little ignorant, and they don't want to realize the fact that you can actually protect against hamstring injury, but you need to, set aside 10 minutes of exercise at least once a week, and do that more or less regularly throughout the season. So it's a matter of tradition, I guess, and within sports, different sports, it's very different. You have a lot of inertia in soccer, which is amazing because you have all these monies floating around.
Exactly.
So protecting against injury, you will save a lot of money to the club, and by the way, also save the player for a lot of inconvenience. In other sports, again, track and field, you have much more individualized, much more in-depth knowledge and interaction between athletes and physical trainers and coaches and physiotherapists. Maybe because track and field athletes are much more individualized and know exactly what you need to do yourself, and you can't do the same as everyone else. You're not packed together in teams like we used to do in soccer and in certain other sports. So we have different traditions, and different moments of inertia towards implementing all this knowledge.
I have just one final question, just switching to a little more nerdy things. You had your first talk about occlusion training that can really seems to have a great potential on muscle level. But since I'm a tendon guy, I was going to think, how about the tendon? Could you comment on that? Because it seems that on the tendon we do not have much data on the healthy tendon to increase the size. Would that be a problem, perhaps, or should we, combine what you just have said? Yeah,
it could be a problem actually. It could, in the sense that if you look at it, there may be 1 or 2, maybe 3 studies, if you include animal studies, on the effect of occlusion exercise and tendon properties, and nothing. I mean, muscle size and strength is increasing, and nothing seems to happen at level of the tendon. So maybe the low forces actually are not the best stimulus for the tendon, whether or not there's ischemia or hypoxia or not. And so, to me, that means that we need to keep on with the heavy resistance training stuff too.
Yeah.
I think the problem would be biggest if you take completely untrained people and do blood flow restriction training, because they have tiny small tendons and their muscles will grow, especially if you have this aggressive twice-a-day training regime, and tendons won't follow.
Exactly.
But if you do that in an athlete who have been years of resistance training, he or she will have tendons this big, which will protect against overuse injury, by the way. Due to the resistance training, tendons will grow. And if you start to improve muscle size beyond that, there will still be a safety factor. And then you can hope eventually, because they will still keep on training their regular training, a tendon will adapt to that increased size and strength. So maybe the problem is not big in trained athletes, but in untrained, definitely a potential problem.
Okay. Thank you, Per.
Thanks.
So
I will hang around, and if you like, you can still post questions during the coffee break. And if you like copies of the slides, don't hesitate to send me an email.
Are we having
I will
a coffee
be happy.
break now? You don't need to have.
Or we don't have a coffee break now?
We don't. Don't we have to have a coffee break now? I think we have. What?
Or we have the next speaker waiting? I don't know.
Oh. I think I'm going.
Oh yeah, sorry. Oh sorry. Oh, yeah. We don't have a coffee break. No, we have questions.
So we are going on now, right? Okay. Yeah. Okay.
But I guess there will be 5 minutes for stretching, standing up and stretching.